I started IV therapy in June of 2022. I was being treated for Epstein-Barr and mold. It was, I had been undergoing therapy for about a year with significant improvements. There were still some residual effects that I was noticing, and root cause had implemented IV ozone therapy and ultraviolet irradiation therapy, and we thought that that would be a nice complement to complete my Epstein-Barr treatment. After that, we began nutrient therapy. I started out with the Performance IV and the IV glutathione for detoxification. I had been eagerly awaiting NAD because I had been studying the effects of NAD on mitochondria and neuro-cognitive repair, which was really important to me. My particular case was rather complicated, and the Epstein-Barr virus did not present itself in a typical way. It was very atypical. So I had neuropsychiatric symptoms that nobody could diagnose. Once we cleared the Epstein-Barr and started the IV therapy, I began to feel better. I was the first patient to try IV NAD, and we continued that for a series of 2 months, and I began to start feeling much better. So I think it's helpful if you understand what some of my symptoms were and what life looked like for me. My symptoms, I had neuropsychiatric symptoms that included paresthesias, which are electric shocks that go all through your body. I would have them across my head, they would run down my legs, and I would have hundreds of them a day. And I had been living like that for about 5 years by the time I came to root cause. I had blurred vision. I had some memory deficits. I definitely had speech impairment and word finding issues. I had some dysarthria, which is difficulty in articulating. It affected my personality, it affected my mood. There were a number of things that it had affected. And again, as I said, I had significant recovery through the treatment by treating the Epstein-Barr. However, there was some residual repair that I still needed. After 2 months of IV therapy, we introduced intranasal therapy as well as sort of an adjuvant to the IV regimen. And I had spontaneous recovery of my neurologic symptoms. So if I had to rate my symptom profile from 0 being nothing to 10 being the worst on average for all symptoms combined before NAD therapy, I would say my symptoms were maybe a 4 to 5 out of 10 on average. And within 3 months of NAD IV and NAD intranasal, my symptoms were reduced to a 0 to 1 over 10. And I've maintained that throughout the course of my treatment. I continue to get treatment. Occasionally, I'm still building resilience and recovery. And if I develop a gut infection and I feel I'm becoming a little bit symptomatic, I come in for another infusion, and that helps support my recovery and repair. The ultraviolet blood irradiation, and ozone therapy for my blood. So I decided to start with that to augment the treatment for Epstein-Barr. It's been used for years, and I looked at the research, and it's clinically safe, and I felt that it would be the perfect augmentation to the treatment that I was receiving. And I noticed quite a significant effect from the ultraviolet irradiation and the ozone therapy. I underwent about 8 treatments before we completed that, and I noticed a significant reduction in symptoms. I have cognitive symptoms, word finding, brain fog, blurred vision from time to time, headaches, daily headaches, and electrical shocks, shooting, tingling up and down my body. I would have hundreds of them a day. It affected my mood, so I was chronically depressed and extraordinarily anxious to the point where I couldn't interact in a normal conversation without becoming so anxious that I would begin to stutter. And I lost my personality, so I couldn't laugh, I couldn't smile, my face would just freeze. So once I finished the ultraviolet irradiation and the ozone therapy, I was still somewhat symptomatic. I was very much improved. I was living a good life. Work was going well. I was highly successful. I was still suffering though from some symptoms, and I was still uncomfortable every day. And I talked with the doctors, and the recommendation was to try NAD. I'm familiar with it and I understand its benefits, and I thought, let's go ahead and give it a try. I found that within 2 months of NAD therapy, both intranasal and IV, I do both, that I had virtually complete remission of all of my symptoms. And I continue to do so to this day.